Tupelo, Mississippi, located in the northeast part of the state in what is referred to as the Hills region. It sits right at the intersection of major highways, railroads, and the famous Natchez Trace Parkway. It's the seat of Lee County, a place where kings were born. Tupelo is also home to North Mississippi State Hospital, an acute care psychiatric facility which opened its doors in 1999. It's a facility of the Mississippi Department of Mental Health, a 50-bed hospital serving an 18-county area in the northern part of the state.
5 years ago, when I offered myself to the people to serve them as their state senator, the hospital contacted me and asked me to come out and tour their facility, and I'm so glad I did, because I always sort of thought about it as just a county asset, and now I realize that the North Mississippi Hospital is a regional asset for the people of this region. And many times it's not the last stop for those that need mental services, it's the first stop. Many times after those evaluations, they're channeled into other organizations to help them seek the professional help they need. And also families are served by the hospital as well. Families can have a loved one committed that may have some type of mental disturbance or alcohol or drug abuse, and we're able to identify that and then help find them the proper resources or care that they need. And most of the time, when we intersect people's lives like that, we're keeping a young man or a young lady out of prison or out of jail, because that's really the next stop if we're unable to help them.
For people in those 18 North Mississippi counties who struggle with addiction or mental illness, this is a place for a fresh start, a new beginning. North Mississippi State Hospital leads the way in partnering with a coordinated network of recovery-oriented specialists, which includes not only medical professionals, but also local law enforcement.
As the sheriff, the state statute requires that those individuals be incarcerated at the sheriff's department in a jail setting, and that is certainly not anything that is helping the situation. As the sheriff here, our officers have been trained in the CIT training, where officers go out to a scene, they can assess the particular situation, and they can directly take an individual from the scene to a facility that is sponsored by mental health. And then later those individuals will be placed in this particular facility. And to have the family support that is this close in case something happens, in case that they're needing an emergency, or just the fact of the peace and comfort of a family member knowing, hey, they're right down the road and they're being taken care of, is something, because mental illness is not just suffering by the patient, but it is very traumatic on the family as well. In the month of January, we had over 27 individuals that were being looked at placing in a facility, and that's almost more than one a day. So in the particular area that we live in, it is vitally important that we have a place here close that we can meet the needs of our people.
Meeting the needs of our people. That might very well sum up why North Mississippi State Hospital is here in Tupelo from the beginning. 2 decades ago, leaders recognized the strain put on families of mentally ill men and women in the northern part of the state. When traveling back and forth from Mississippi State Hospital south of Jackson to what was then the nearest adult psychiatric facility, a 5-hour drive for some in the northernmost counties. Something was needed closer to home, and so the vision for this hospital began. And 20 years later, North Mississippi State Hospital is still helping to create new beginnings.
This is the most fulfilling job that I've ever had. I mean, I really love what I do, and it's a purpose. It's a purpose that I've never felt before.
Nathan McVeigh serves here on a team of peer support specialists.
Through my experience with drug addiction and mental illness, that I'm here to connect with the patients and to show them how I found the way into recovery and how I can continue my recovery on a daily basis.
I have over 3.5 years clean from drug and alcohol, and 2 years into my recovery, I started having really bad depression, and I went and got checked, and or I was crying a lot, and I went and spoke to the doctor, and he said, well, you've been self-medicating for 10 years. So he put me on an antidepressant, and I was kind of upset about it. And then I accepted it, and as my journey went on, I was doing all the things that were suggested of me to do, like the same things we suggest here to the clients. And someone that worked here previously noticed that, and she was taking a full-time position somewhere else, and I accepted it. And so from my experience of what I've been through from drugs and alcohol and not wanting to take medication when I need to, I'm glad that I can give that to the clients here. Let them know that there is hope, that there is a way out, that it's okay to do things when we're afraid to do them, and change is scary, but it can be worth it.
When I get into work, I make sure I speak to them, make sure I ask them how their day been. I make sure I ask them if they're having any problem, make sure they come to me. And they can relate to me easier because I interact with them in the morning when I get here. And that means a whole lot to the patient when you interact with them. Basically, they need to know that you really care about them. Once they see that you care about them, it's easy to work with them then. Yeah, we had a patient one time was here for a good little while, and I ended up seeing him on the outside. And he came up to me. He said, hey, Mr. Jimmy, how you doing? You remember me? I said, yeah, I remember you. And then patient always tell me to thank you for what I did for them. And that really mean a whole lot to me. That mean that I done did my job. We here to help them get back in the community. If they need help, we here to help them get on their medication. And once they get stabilized on their medication, they can get back in the community and do well in the community.
Over 10,000 patients have been served here since the doors opened in April of 1999. In 2018 alone, the number was 538 patients served. The hospital provides employment opportunities by having 95 full-time service employees, 6 full-time contract employees, and 29 licensed professionals providing services. It also creates the demand for 77 indirect employees in various businesses that provide services or products to the hospital. The total expenditure of over $7.2 million in 2018 generated an economic impact just under $12 million for the service area. It generated an estimated $466,000 in general fund collections and another $43,000 in local tax collections. At North Mississippi State Hospital, core values are not just stated, they are put to use every day. Hope, trust, communication and education, professionalism, teamwork, compassion, and respect. You'll see it on display always at North Mississippi State Hospital.
The key is communication. If you can communicate with them and talk to them and get on their level, the job is easy. The key is communication and respect.
As I sat on the State Board of Standards and Training, which regulates all the training throughout the state of Mississippi, and I was proud to be one of the votes that supported mental health being taught in our state academies as a mandatory part that helps officers be trained right at the very beginning when they're being placed out on the street of how to deal with mental patients. So, you know, the whole program as a whole is a wonderful program that helps law enforcement, but to have it here close where we can, you know, piggyback on each other in the time frame, it's something that's very valuable.
It's vital to this region. It services an 18-county area. And without that facility here, many of our Mississippians here, our residents in North Mississippi, would have to travel to Jackson or even into South Mississippi for services. So it's really it's a front line of mental health for this region.
You know, these patients oftentimes will not open up to a doctor or a therapist that hasn't been where they're at. And so when I talk to them and I share a little bit of my story and where I've been and tell them that, you know, I've been through what you're going through, then that allows them to trust me
I think the state hospital provides a place, it's a safe place when people are out in the community and they don't know where to go or what to do. And even though some of them are committed, the majority of them are by their family members, this is a place where they can rehabilitate. They've got the people here that have been through it.
And to have a cooperative and working relationship with your state hospital, and especially with the one that we have, it's a daily thing that you're having. So, you know, the camaraderie that you have between the Sheriff's Department and the state hospital and their employees is something that's par to none, and ours is the best that there is.